Yeah, you can use either one.
Just hold it. So I got this cool iPhone app from Cumming, and he showed me how to do this, and you can change your slides on your phone. So that's pretty cool. So thanks for the invitation. We'll just make this discussion low key. We do have a bunch of really helpful cards on the back table as you leave the room on blood pressure, fast foods, cholesterol, and fitness and exercise, and some stuff on heart healthy things with women. So feel free to take those. My cards back there. My cards are there, and so my email address is on there too. I don't mind if you email me if you have any questions about what came up today, because usually there's a ton of questions that I can't get to. You can call, you can email, I'll answer them. If there's anything specific, people always have questions about cholesterol. So this talk today is mainly going to be lipids, cholesterol, which will hopefully factor into your healthy lifestyle discussion. So as cardiologists, when you come to see us, the 5 big risk factors we look at for assessing anybody's cardiovascular risk. Number 1 would be the family history from mom and dad, diabetes, hypertension, smoking, and lastly, high cholesterol, which we'll talk more so about today. And all right, so cholesterol is a natural substance that we need. It's found in many foods, as you'll see on all the things that you buy, but it's mainly used by the liver to make things like hormones, estrogen, testosterone, various vitamins and other substances. So it's really a very needed thing for your body. We refer to it as dietary cholesterol in food, and it's mainly produced in things, as you know, like red meat, eggs, and dairy products. And so generally, besides for genetic predisposition where someone may have cholesterols that are elevated even if they eat lettuce 3 times a day, generally if you're eating more calories than you're burning, you're going to end up with more cholesterol than your body naturally needs to make those things like hormones and liver function, etc. And so your blood levels will be elevated. So when you get blood cholesterol levels, that's essentially what we're measuring in your blood. What's considered a high cholesterol diet would be anything over 300 milligrams a day. Essentially, every package now in all the grocery stores are required by law to have these numbers on there. So people ask, what's a low-fat, low-cholesterol diet? So that, for the American Heart Association, would be less than 300 milligrams of cholesterol. Otherwise, those will build up, clog arteries, cause heart attacks and strokes. And approximately 15 to 20% of the U.S. population has high cholesterol, that's liberally defined as more than 240 milligrams. We're a lot more stringent than that. If you came to see us, it would be 200 milligrams per deciliter is what we consider above where it should be. And this is kind of a busy slide, I apologize, but having high cholesterol, you can see there the number of deaths from the CDC in 2009, quite significant. And the heart disease, as you know, besides for cancer, is the leading cause of death in the United States. So, high cholesterol in and of itself doesn't have any symptoms. People only find out about it if they get admitted to the hospital for some other reason, or their doctor checks it on a regular basis. So the average level is about 200, which is borderline high. Believe it or not, more women than men have high cholesterol in the United States. But the good news is that since the 1950s, all of this has been dropping, probably because of public health efforts to educate people, put things on labels so that you know what you're buying, and make basically the consumer more conscious about what they're putting in their mouth every day. And essentially, patients with high cholesterol, it's not just for heart disease, but also stroke, but at least a twofold increased risk in heart disease in any form or stroke. And essentially, this is what we're looking at. So this is a blood vessel. These are plaques that develop over years. We know that plaques start to develop roughly when we're in our late teens. They've done studies on kids that were killed in Vietnam War and did autopsies on them, and they already had fatty streaks and cholesterol plaques in 18-year-old kids in their aortas, coronary vessels, cerebral vessels. So this process doesn't happen overnight. When people come in and they have a heart attack and they have a stroke and they say, hey, doctor, how did this happen? This has been going on for years. So in order to reverse this process, you have to start early. We're usually checking cholesterols now, somewhere around age 30, I think is appropriate to start checking cholesterol. We don't want to be checking it in teenagers because they're still growing and producing hormones and things like that, but probably around 30, especially if there's a family history, you probably should know what your cholesterol is. That's not too early to know. And again, the reason is that because if you need medication or lifestyle changes, you want to do it at 30 so you don't have your heart attack at 60. And same thing here. So you have a normal artery, it's a cross section of an artery. That little plaque that develops there in the top right can be caused by diabetes, can be caused by high blood pressure, can be caused by genetic factors that we haven't understood yet. Once there is a damaged inner lining of an artery that allows the cholesterol to develop in the artery, it gets bigger and bigger depending on whether you're a smoker, whether you have high blood pressure that's not controlled, whether you don't exercise, whether you have bad family genes. And so patients can present at 40 with those types of things or never. And you just see it on autopsy. So the National Cholesterol Education Program was formulated by the NIH. They recommend that all adults have their cholesterols checked at least once every 5 years. Most people are pretty good about doing this, but there's a lot of people that don't know what their cholesterol is, including some in our office, by the way. So we've already talked about that. And there are different. The Hispanic population. About 50% of Hispanics don't know what their cholesterol is or how to check in the last 5 years. So there are some ethnic things that we need to do better with public health-wise. And you see that here in this slide, pretty much says the same thing. The percentage of people with high cholesterol. Basically what you see for men, 45 to 54 is when we're seeing patients present with high cholesterol values. A little bit older in women probably has something to do with the estrogen protection, which changes when women go through menopause, 50 and older. And so when you get your cholesterol done by your doctor, the thing that most people don't ask is what their numbers are. And so one of the things that I stress when I do these types of talks is that if your family doctor measures your cholesterol, you're going to get these 4 things, and you should ask the nurse that calls you what the numbers are. Because frequently you're going to get a call, and all physicians or nurses are guilty of this, and they'll say, your cholesterol is good. And I don't know what that means because some people think a cholesterol of 210 is good, okay? So you're going to get a total cholesterol, you're going to get an LDL bad cholesterol, an HDL good cholesterol, and a triglyceride level. And you should ask what those numbers are and educate yourself that these are what the numbers should be. So 40 is actually low, where we've actually bumped that up to 50 milligrams or higher. And we're going to talk about each one, specifically the LDL or bad cholesterol. So the LDL or bad cholesterol, when you want to think about this, I kind of think of it like a train. The HDL or good cholesterol brings the cholesterol out of the blood vessels back to the liver so it can be metabolized into other things. The LDL cholesterol does the exact opposite. It brings all the bad cholesterol to the blood vessels and it kind of buries into the blood vessels and causes plaques to develop. So as cardiologists, we generally focus on what your LDL cholesterol is as the bad actor. That's the one causing strokes, the ones causing heart attacks, and the ones that the statin drugs like Lipitor, Crestor, etc. Target the most. So your blood test will give you those 4 things. The LDL is one of the 5 major groups of these lipoproteins. Again, they come naturally. That's the way we're born. They're needed to transport fat molecules, but unfortunately when they get too prominent, they cause plaques. They can vary in size and density. One of the things that you may have heard from your family doctor or whatnot is to get a special lab test, which is called an NMR lipid profile. Probably not a bad idea for everybody in this room to have one at least at some point. And I mention this only because it's becoming more common. You see this in the news a lot. People come in and ask about this special cholesterol test, and essentially what this does is it takes those four things that I just mentioned, the total, the LDL, the HDL, and the triglycerides, and it splits all that into its component parts. So each one of those particles is then split into all its other little particles, of which there are many. And we know that people who have early strokes, people who have early heart attacks, are people who have the very small, dense LDL particles, which is called pattern B dyslipidemia. You generally get that from mom and dad, not from going to McDonald's too many times. And so this NMR lipid profile can help you determine whether you have this, because you can have a cholesterol, believe it or not. I saw somebody this morning whose cholesterol was 184, but when they did the NMR lipid profile, their LDL particles were out the roof. And so even though their LDL on the surface, I think it was 101, which is not bad, unfortunately all of the 101 particles are all of the bad variety. So they're all there can be small or big, and this person's happen to be all small and too many of them. So even though that person on the surface, if they just have a plain old lipid profile, would say, hey, cholesterol's not too bad, keep working on exercise and diet, it's actually, hers was quite high. So she's now on Vascular. And so these are the types of things. I think if you get one at least, you don't have to get one every year, but I think if you get one at least, at some point, it's a reasonable thing to look at. And again, because the LDL particles transport cholesterol into the artery wall, that's what's increased. They have the increased risk of what we call atherosclerosis, hardening of the arteries, early blockage. And over time, these plaques rupture. They activate blood clotting. They produce arterial blockage, which is a heart attack or a stroke, or a brain attack is what we call it. And if severe enough, they end up in the emergency room with symptoms of chest pain, symptoms of stroke, or symptoms of bad leg pain, which is peripheral vascular disease. You're going to see I see a lot of commercials for Plavix these days on the news for people with PVD, peripheral vascular disease. And again, all of this is the same thing. An artery is an artery, so whether a plaque develops in a leg, a kidney, an aorta, a coronary, a cerebral vessel, it's all the same process. It's basically interruption of that lining of the artery. It allows these LDL cholesterol particles to kind of wiggle their way in there. If you combine that with smoking, hypertension, not exercising, bad diet, it's just a matter of time. And this is kind of the process of how it goes along from a biochemistry perspective. This is a pathologic slide. On the left is an artery. In the middle is a thrombus, otherwise known as a blood clot. And what you see there is a ruptured, this ruptured plaque. I don't have a pointer, but right up there in the thrombus, there was a plaque that ruptured. You see this lipid-rich core, which is all cholesterol in the artery itself. All of that should be cleaned out. It should be a big donut with a big white space if it was a normal artery. So this person had a lipid-rich cholesterol in their artery. It ruptured. All the little red areas where it says thrombus and all throughout the lipid-rich core are platelets, and then essentially a big blood clot is what that is. And if that's in a cerebral vessel, that person's having a stroke. If it's a coronary vessel, they're having a heart attack. This is what we fix when we go and we do a heart catheterization, when the interventional radiologists go in and they put blood clotting medicine in the brain to prevent the progression of stroke. But what you'll see is we'll go in with our heart cath. On the right side, you see is a placement of a balloon angioplasty where the blockage is broken up by a balloon, and then a stent is deployed. The stent then becomes part of the artery wall, keeps the artery open, and restores normal blood flow. And that's kind of the pathology of having a heart attack. I'm going to skip over this for the interest of time. So the HDL cholesterol, get a lot of questions about this because a lot of people's HDL cholesterol is not good. It's generally the hardest of the 4 things to change. And again, one of the 5 groups of lipoproteins. And just like the other ones, it's needed in the body to make normal things. They're able to remove cholesterol from the artery plaque, transport it back to the liver for excretion, or the liver reutilizes it to make different things such as steroid hormones, testosterone, estrogen, the adrenal glands, and things like that. And those with higher levels of HDL, so again, if you have, these are little trains running around in your blood vessel, the more trains you have removing cholesterol back to the liver, the better. So if you have an HDL of 90, it's very unlikely you have coronary artery disease. If you have an HDL of 30 or 25, lowest I've ever seen was 15, that's a very big risk factor. Each one of these things, whether it's low HDL cholesterol, total or LDL is high, all of these things are independent risk factors for heart attack and stroke. You want to try to do your best to get all of them better. One is not necessarily more important than the other one. Levels that we want, generally if you can remember the number 50, that's about where you want your cholesterol to be. Higher than 50, higher than 60 is even better. Men tend to have noticeably lower HDL cholesterol, smaller size than women. Again, this is probably something to do with hormonal shifts as we age. Alcohol, specifically red wine, tends to raise HDL cholesterol. So the moderate alcohol consumption is actually recommended by the American Heart Association. And the definition of moderate alcohol is, anybody know what the definition of moderate alcohol consumption is? So yeah, I usually tell people you can have a big glass of red wine, shot of hard liquor, or 2 beers, somewhere in that range. Beer. Once a not every hour. But that's pretty good to have one at least at night. So I usually tell people, because lots of people are afraid to have alcohol because they think it's going to hurt their liver because they're on heart medicines. And I say have a glass of red wine every night, and you'd be surprised how many people are happy about that because they haven't been drinking anything because they thought if they were on whatever, they couldn't have one. But actually, if you go on the American Heart Association website, that's what the definition is, and go at it. So population studies, high concentrations of HDL decrease your risk for heart attack and stroke, low increase it. And for any given level of LDL, the risk of heart disease goes up 10 times as the HDL varies from high to low. So it's a very, again, it's the bad train, the good train, the bad train, the good train. If you have too many good trains, you're actually in a good course. But unfortunately, typically when you see people with very high LDL cholesterol, the HDL is also very low. Part of it's diet, part of it's exercise, but you have to understand a lot of this is genetic. People get very frustrated when they can't get their cholesterol levels where they need to be, and it's really because you inherited from mom, dad, and Uncle John, and Aunt Sally. So don't get frustrated. Triglycerides, just we'll note this, you see all of this in the news about diabetes going up and up and up. There's lots of sugar in our foods, there's obesity that's rampant, there are governors trying to limit Pepsi consumption in New York, all because the obesity rates are just skyrocketing, especially in children. Why am I saying all this? Triglyceride levels are typically very elevated in diabetics. If your sugars are not under control, we see a lot of people with triglycerides of 400, good cholesterol that's 25, and you see, mostly we see this, first thing when I see that is what's their sugar, are they diabetic, are they behaving with their diabetes, and usually the answer is no. So if you have high triglycerides, that's one thing you want to make sure. There's 2 things with actually when you see that, thyroid disease and diabetes. You can also see it in alcoholics, but those are the 3 major reasons why triglycerides are elevated other than genetic factors. So high carbohydrate consumption, again, Pepsi, sugary sweets, things that have what the South Beach diet refers to as a high glycemic index cause overproduction of insulin. That then increases triglyceride level and decreases HDL cholesterol. That's the whole thing about South Beach diet is the glycemic index. Which foods on your plate like the rolls are high glycemic index, and broccoli, for instance, isn't. And so the whole book is about picking those foods which are going to keep your glycemic index low, and therefore that's going to help your triglyceride levels and your insulin levels and all those bad factors that go along with it. Adverse changes associated with carbohydrate intake, high triglycerides, strong risk factor for heart disease, both men and women. I already mentioned alcohol, diabetes. This is where the topic usually come in, because everybody wants to know about fish oil, because everybody's on fish oil, because you can get fish oil pretty much everywhere. Costco, 100 tablets for $9.99. And the thing about fish oil, just 30-second blurb, is fish oil is very good if your triglycerides are elevated, but it doesn't really do anything else for cholesterol unless your triglycerides are high. So if you have completely normal triglycerides and you want to take fish oil, that's perfectly fine. It's not going to change your LDL or anything, or your total cholesterol at all. There are other benefits to fish oil, however, such as it's recommended in kids with ADD. It's now coming out that it's may halt or slow the progression of Alzheimer's. It's good for the dermatologists, like it for skin and nail health. So there's other benefits to fish oil, but as far as the cholesterol profile goes, if you consume 2 grams of fish oil a day, that'll be very good for getting your triglycerides down. And then the other thing is that there's tons of fish oil products out there. You just have to make sure you're buying it from a respectable company, because there's a lot of fish oil that's cheap and not good, because it has a lot of impurities, specifically mercury, saturated fat. So just recommend you pick a good company that has a good reputation. GNC has a good like triple strength fish oil product. There is a prescription grade fish oil that's the best, which is called Lovaza, L-O-V-A-Z-A, and it's a prescription only. You got to get that from your doctor. This plus minus covered by insurance, but generally for a fish oil capsule, if you hold it up to the light and you can look through the capsule and it's clear, then it's a good product. If it's dark or it's cloudy, it's crap. Don't buy it. And if you look at the Lovaza capsule, it's almost crystal clear. So it is a good product if you can afford it. So, So all the labels now, we have all of this to look at when we're at the grocery store. We're looking at saturated fats, trans fats, cholesterol, sodium, carbohydrates, protein. It's kind of dizzying, actually. But they're required to do this, and I think when the new rules with the health care plan that was passed and upheld by the Supreme Court go into effect in 2014, it's going to get even more stringent for restaurants and any place that you eat out, and you have to be educated as to the calories you're eating and what you're eating on demand, which obviously small businesses are not happy about. So there are numerous types of fat. Your body makes its own fat from taking in excess calories. Some of the fats are in foods from plants and animals. That's what we call dietary fat. Other fats are along with proteins and carbohydrates you need for energy. It's essential to your health, as I mentioned, for bodily function, but there's a big dark side of fat. And the concern with some types of dietary fat is that they play a big role in type 2 diabetes, obesity, cancer, and obviously heart disease. It's the biggest, our biggest component of what we call trans fats would be things like donuts, French fries, and the reason why is because trans fats are not found in nature. They're made up, they're scientifically based. They're basically oils that scientists have figured out how to hydrogenate, and they're basically liquid oils that withstand certain types of food processes. They stay on the shelf longer, they taste good, which is why we eat them, and as a result, the trans fat has really gone up and up and up over the last couple of years until now, with all the bad press that trans fats have gotten. French fries from McDonald's are advertising no trans fats and whatnot. But generally, if you're looking on the package and anything that it says partially hydrogenated, if those words are in there, that means they have trans fats, even if they say trans fat is 0. Because in order to do partial hydrogenation, it has to be some type of chemical, scientific way of changing those oils around, and essentially those are the bad fats. So I think we covered all of that. Just move on. So saturated fat is not essential to your body. It's found mainly in meat, poultry, and dairy products like whole milk. These are all foods that contain dietary cholesterol. The bad oils, or the cheaper oils, peanut oil, palm oil, coconut oil, have a lot of saturated fat. Those are also oils that you want to stay away from. The Mediterranean diet, which is also a good diet to be on, is loaded with olive oil and the good oils, which are less in the saturated fat and more in the polyunsaturated fats. You want to be very careful. The box says no cholesterol because it's probably just trying to get you to buy whatever, but it may still have other saturated fats or bad fats in it if you don't read the label very carefully. The reason why this is bad is because saturated fats raise the LDL or bad cholesterol more than just plain old cholesterol itself, so that's what you want to watch out for. And again, if you're looking at the American Heart Association's what is a low-fat diet, you want to try to keep your saturated fat grams between 16 and 20 per day. If you've had a heart attack or stroke, it's even more stringent to say less than 16 grams a day. And where can you get that information? Well, it's on every package, so you just add up what you're eating per day, and you'll be able to figure out how many calories and grams of fat that you're eating. And this is no surprise. More of this stuff you eat, higher chance you're going to have a heart attack, stroke, high blood pressure, and AHA recommends reducing your saturated fat intake to less than 7% of your total calories consumed. So again, you got to do some math here. It's very, the reason why people are not good at this and people aren't good with diets and whatnot is that, it does take a lot of effort to do this stuff. You have to read the labels. You have to figure out what's 7% of my total calories, which assumes that you even know what your total calories are. But if you really are health conscious and you want to make changes, these are the things that you need to do. This information is out there on the web. You can easily download it. And all of this stuff has been scientifically proven of what you need to do. So the healthy fats is what we want to concentrate on. So those are the monounsaturated fats and the polyunsaturated fats. So we were going with the salmons, the fish, all the boring foods, the olive oils, things that you can't have, like that cheeseburger that looks really good on the one before. So the monounsaturated fat is a type of fat found in certain foods and oils. Eating foods like this is known to improve health, blood cholesterol levels, again, Mediterranean diet, benefits insulin levels, blood sugar control, which is very helpful if you have type 2 diabetes. Same thing with polyunsaturated fats. No diabetes, no hypertension, healthier you. And then one of the types of polyunsaturated fats are the omega-3 fatty acids. So if you can't eat a lot of salmon or you don't eat fish 3 times a week, which is what's recommended, you can get the omega-3s in these capsules that we just talked about. But again, for that conversation, make sure wherever you're buying, you're getting a good product. Olive oil is a good thing. Cashews are excellent nuts. The best nut to eat would be almonds because they're loaded with the good fats. And again, the reason why the French fry, because what they're cooking the French fries in is all the bad, cheaper oils, which then get translated into bad fats in your system, and then cholesterol goes higher. Any questions while I'm going through this?
You want to comment on the internet positions in Dr. Oz?
On the what?
On the internet positions in Dr. Oz?
Yeah, most of the stuff he comes up with is pretty good. Just like anything else, it's it's information. It doesn't necessarily mean it's good or bad information. It's just information. You have to do more research on your own. But patients come in all the time. Dr. Oz says this, Dr. Oz says that. I don't disagree with the majority of stuff that he says. The thing is that the reason why I mention this is that when people come in, half of their medicine list are vitamins. We're seeing this more and more. People spend $1 zillion on vitamins. Vitamin D, vitamin C, blueberry extract, cranberry extract, and stuff people come in with. I have no idea why they're taking it, but they do. And I basically say, they don't teach this stuff in medical school, and it may be very beneficial, but there are no studies, so if you take it, and it may help you, it may prevent urinary tract infections, it may help your eyesight, but there isn't any information, and I guess as long as you're taking it within the standard, you're probably okay. But, so aspirin for men, it's recommended 45 and older, for women 55 and older. Mainly the benefit for men is early prevention of heart attack, for women it's early prevention of stroke. But just like anything else, however, aspirin is a very potent drug, and you have to be very careful prescribing aspirin. We see a lot of bleeding with aspirin, extensive bruising with aspirin. So you kind of have to weigh the risks and the benefits of what your risk profile is and whether you think you should start aspirin or not. I never use more than a baby aspirin unless somebody's in the hospital and they just had a heart attack or stroke. Then we usually use 325 aspirin for the first month and then a baby aspirin thereafter. It's very hard on the stomach, and it's just a hard drug to take. So it's not benign, but if you want the recommendations, it's men 45, women 55. One thing.
Comment on a cholesterol that has high HDLs and high LDLs.
Yeah, so you'll have people that, again, when you see, so I'm just going to say for the sake of argument, let's say your HDL is 80 or 90. We saw a lady, her HDL was 90, but her LDL was also 180. So again, most people would say that having an HDL level that high is protective to a point. And so it also depends on what the other patient might have. So are they hypertensive? Did they smoke? Are they diabetic? And then factor in whether or not they need to be treated. So you can say, yes, your HDL being high is protective somewhat against a very high LDL cholesterol, but it's certainly not the end-all, be-all, and certainly no reason not to take a cholesterol medicine, even if your HDL is really high. But my guess is, if your HDL is that high, or somebody's HDL is that high, in order to get that way, besides where you have stupendous genes, is you're exercising, you're eating right, you're doing all the healthy things. You're probably a low-risk patient to begin with to get your cholesterol that high, your HDL cholesterol. Usually you see that in marathon runners, bikers, people who really exercise a lot. Most people hover around 40, 50, 55 with an HDL cholesterol. Did you have a question?
I have a question about statins.
Yeah.
If you start to take that at a relatively early age, do you develop resistance to it?
So we get lots of questions about statins. No one wants to take them because they get a lot of bad press because they cause liver problems and muscle aches and cramps. So the statin drugs are the best drugs to lower total cholesterol and LDL cholesterol. The risk of those bad things happening is very small, but it can happen, and we counsel people about that. There is no resistance to statins. Usually once you start them, you can't come off of them unless you make major lifestyle changes, like lose 100 pounds, start exercising a lot more, that kind of thing. But again, a lot of this is genetic. Some of it's dietary. Once you're on it, you're usually on it. And if you're on 10 milligrams and that works for you, you're usually on 10 milligrams.
There's some products now, orange juice, and Benecol, and things like that. They have plant sterols. How well does those work?
Again, for the smart butters and things like that, all these are trying to block cholesterol in the gut with things that you eat, and they're going to help your cholesterol somewhat, but it's for people with mild cholesterol problems. It's not going to be the treatment if your cholesterol is 250. It might be something that you add to what you're already doing with your doctor to get your cholesterol 250 down, as opposed to eating regular butter. But I use that stuff just because I have better taste. But it does work, and no reason not to use it. So.
Have there been any scientific studies about K2 and nitric oxide, flow of blood?
Okay, so that's a huge, big question that you could answer, probably a big textbook on that one. So I think I'm getting your question right. You're asking about nitric oxide.
Nitric oxide and vitamin K2.
Okay. I don't know about vitamin K2. Nitric oxide just to kind of go on what nitric oxide is. Basically, nitric oxide is how Viagra works, okay? And Viagra, okay? And what happens is with people that are diabetic, hypertensive, high cholesterol, they have what we call endothelial dysfunction. And so that's the big long name, which basically, a blood vessel is, the inner lining of a blood vessel is called the endothelium, okay? Most people would consider that the largest organ of the body because it's actually a very active organ, and because it constricts, it relaxes, it constricts, it relaxes. If you smoke, it constricts. If you're out in the cold weather, it constricts. Things like that. So it's a very active organ. Nitric oxide is known to dilate blood vessels. Okay, so that's the way Viagra and those products work, because the smaller blood vessels no longer have function to dilate or respond to normal stimuli without nitric oxide. Nitric oxide also works in the lungs, so we have people with severe pulmonary hypertension, emphysema, things like that inhale nitric oxide. And what that does is also improve the endothelial function of the lungs. To my knowledge, there's nothing yet, at least in the pipeline that I know of, that with nitric oxide and cholesterol. Mainly it's nitric oxide in regards to blood pressure, and blood pressure control, lung function, and overall health of the endothelium, because the thought is that damaged endothelium from smoking, high blood pressure, diabetes, and all those things we talked about damages, basically the endothelium can't respond, and nitric oxide helps.
So, check on K2.
Yeah. Lunch next month.
Okay.
L-arginine is also, I get a lot of questions about that, so L-arginine is also a vitamin that increases or is used in the nitric oxide pathway, and is also helpful for that for lowering blood pressure. Let me just see which one. Fish oil, glass fish oil, cod liver oil, same thing. These are all about the fats. And again, any questions you can just email me. We'll take one last one.
My doctor put me on Metamucil twice a day, and it kept my cholesterol down quite significantly over a period of a couple of years.
So there's basically three silos of drugs that you can be on for cholesterol. So you have the statin silo, you have the fibric acid silo, and then you have kind of the gut or cholesterol silo. So the Prestors and Lipitor are over here. Niacin or Niaspan is also used. There's another drug called Tricor or Fenofibrate that work also in the liver to lower cholesterol. And then you have Zetia, which you probably heard in the news. You have Welchol, which is also a prescription drug. And then things like cholestyramine, Metamucil that you mentioned. And all of these things basically act locally in the colon and in the digestive tract to prevent absorption of fats of whatever you're eating. So you just happen to be in the third silo where that is working for you. And some people choose that because it's not absorbed. So there's no drug-drug interactions, there's no passage through the liver, there's no passage through the kidney. It's just working to block absorption of cholesterol and the process of digestion, basically. So, yes, sir.
What's the latest thought on eggs?
Eggs?
Eggs.
Has it changed?
Years ago, I heard that you shouldn't eat eggs, and then I had read that eggs are all right.
Well, so generally egg whites are fine. It's the yolk that contains all the cholesterol, and I think everything in moderation. But generally, eggs are a no-no if you've had strokes and heart disease, because it's going to raise cholesterol. So just call or email if you have any questions. Don't forget your little cards. We got them back there. Lots of information on there.